is a duckbill-shaped device used to examine the vaginal walls and the cervix. The pap smear or pap test is a procedure that detects possible pathogens and screen for cervical cancer by collecting cells from the cervix. Mayong hapon, ma'am. Ako si Odyssey Key, isa ka junior clerk sa Cebu Institute of Medicine. Karon, ma'am, atong buhaton kay Speculum Exam ag pap smear. Na ako isulod na aparato sa imong puwerta para makita nimong cervix. Magkuha ako og sample kani siya ang ginatawag na pap smear. Uncomfortable ni siya gamay, ma'am, pero kadyot lang jud. Musugot ra ka ani, ma'am. Sige, palihog lang kog tangtang sa atong underwear, ma'am, ug higda. For the materials, you would need a clean gloves, glass slide, cotton tip applicator or cyto brush, airy spatula, speculum, and lubricating jelly. Place patient on a dorsal lithotomic position. Put on gloves and observe aseptic technique throughout the procedure. Use the appropriate speculum for the patient. Warm the vaginal speculum. You may also put a lubricating jelly on the outside surface. Insert the speculum by placing the transverse diameter of the blades in the anterior-posterior position and guiding the blades through the introitus. Once the blades are inserted, the speculum should be turned so that the transverse axis of the blade is in the transverse axis of the vagina. Once the cervix is visualized, the speculum is open and that the introitus is widened by using the screw adjustment on the base of the speculum. Inspect the vaginal canal for evidence of erythema or lesions. Cervix is then inspected by taking note of erosions, shape, transformation. Hold the endocervical canal with a cyto brush or a cotton tip applicator. It is placed in the canal and rotated. Material obtained is then smeared thinly on a microscopic slide, labeled as endocervix and fixed immediately. Immersion of the slide into a fixative solution. Using an air spatula, the entire transformation zone is scraped, and then the sample is smeared thinly on a second slide, is immediately fixed and labeled as transformation zone. Remove the speculum by twisting the adjustment screw and closing the spatula. Bring the spatula sideways and remove it gently. Document and explain the findings to the patient and inform her what to expect after the procedure and when the results will be available. Ask patient for any questions or clarifications. If there is none, thank the patient.